I'm bringing the greetings of Dr. Michael Rich. He's actually in Canada, so he really wanted to come here, but life is life. And so I want to continue this conversation with you. And first of all, also, I want to thank Karen for finding this beautiful place to have this very important conversation to have right now. And I want to start with a question for you. And my question is, how much do you think that you are going to spend on your smartphone during a lifetime? How much time? How many? 40? Okay, maybe it's too much. 4? Okay. Well, I will give you a hint to answer to this question. You see these two pictures. The difference between these two girls is time. It's about 13 years. 13 years, the time from when you're born to when you're a teen, is the average time that today we are going to spend on smartphones. When I think about the social media part, now with AI, maybe we need to recalculate these numbers, because we have heard this morning 8-9 hours spent chatting with a chatbot, but it's 13 years. And if I ask you another question, which is how do you think your screen time today is shaping your health and mental health? Well, we hear about that a lot. And let's be honest, the answer is not always positive. It's rarely positive today. But I've been part of this conversation, not only with scientific papers and conferences, but also with workshops, bringing together experts from all over the place, all over the world, and talking with them for days with our question, is social media a good thing or a bad thing for our health and well-being? And the answer is always, it's complicated. Because there is no effect that can be applied to everyone. We are all different. There is no black and white. And it depends on the individual, on the context, and also on our vulnerabilities. For example, our genetic vulnerabilities, and especially on the purpose. And another element that is complicated is how to define well-being. Well-being is a multidimensional factor. It's made of different components, like a balanced meal. We have different ingredients, like happiness, life satisfaction, meaning and purpose, mental and physical health, financial stability. We have a lot of elements. And if we want to continue the metaphor of Dr. Rich, when we think about screens and social media at our plate, we also need to think about that as a healthy diet, as a healthy meal. But the point is this one. If I give you chocolate and salad with no directions, with no labels, you will start eating chocolate without realizing that a little is fine, but too much is going to be harmful. So we need direction. We need to know what is a good way to use technology versus a bad way. Because salad might be boring at the beginning, but actually is what is making all the blocks for a healthy living. And another factor why it's complicated to study this topic is that sometimes it's like looking at 3 moving targets. I'm working a lot with teenagers, and the first moving target is human development. It's always in motion. The development of ourselves is from the beginning to the end, because when we think about older people, they're also using technologies, but in a totally different way sometimes, and we don't think about that. The second moving factor is the tech ecosystem is always changing, new apps, new features, new ways of interacting with each other. And then we also have the continuous dance of influence between the tech ecosystem and also our behavior, because we are always reachable and can be always be distracted, and we also influence how technology is developed and the other way around. So it's really a challenge, because when we study media effects, it's like trying to catch in a train that actually is already leaving. And then another one is coming, another app is coming, and then we need to change the focus. And you know what? Sometimes science is very slow. And so it's difficult. And another factor is, what do we want to measure? We are talking a lot, and the conversation has been focused on the importance of screen time, the time. Okay, fine, let's measure screen time. Let's measure that well too, with trace data, screenshots. I've done that in my research. And the fact is that the more you look at the objective data, the more what you found is a tiny effect, something like 1 extra minute of TikTok use corresponded to a 0.4% decrease, 0.04% decrease in well-being daily, which is a very tiny and negligible effect when we think about screen time. Because it's like not even looking at a small apple, but like trying to see the ants that are trying to get that apple. The point is that screen time today is not enough. Indeed, in scientific papers, if we only measure screen time rejected, like it's not enough. You need to measure something else. We need to go beyond screen time. And one important aspect is, for example, social relationships. I will talk about that in a minute. But also all the other psychological mechanisms that are happening even after you stop using the phone. Maybe you are wondering, you are ruminating about something, why this person is not answering me, what that emoji means, and I'm expecting, a message from someone, or I'm thinking about that news. So all these things are happening outside the screen time. And not only that, how do we measure what we are not doing, what screen time is displacing? It's very difficult. So this is why this conversation is complicated. But let's go back to one of the main topics of our research, which is the developmental period. And so let's start to look at some results and that are part of our conversation today. One thing that we should remember is that the teen brain is developing in a way that is very unique. In particular, we have two systems, the cognitive control system in the prefrontal cortex and the reward system in the striatum and nearby areas, that are developing at two different paces. The cognitive control system is very slow. Actually, is not reaching the full maturity until 25 years of age, which is quite a lot. So this is why for teenagers can be particularly difficult to regulate their behavior online. So they can be highly motivated by rewards because the reward system is very active, but struggle with impulse control because the prefrontal cortex is what allows us to plan and control our behavior. And so the adolescent brain, in the end, is like driving a high-powered car, but with a brake that is not working properly. And this is why we also have some sensitivity windows during that age. In particular, for girls, we know that between 11 and 13 years of age, they can be more susceptible to the negative effects of social media, while for boys is between 14 and 15 years of age. And then again, for all genders at 19 years of age. And the explanation can be either biological, related to puberty and change of hormones, but also contextual when they go out to study or work. And so another part that we need to consider is the role of the context, the online and offline context. And when we think about that, balance is the key. Balancing our time is really what can help us in finding a good way to use technology in a healthy meal. For example, in a study, we were able to follow about 1,000 participants in Switzerland over time, and what we found is that the group that was showing a balanced time spent on different activities, so not only spending time online, but enough time doing sports, reading for fun, time with friends, homework, and enough time to sleep, they were also the ones that at the end were showing higher NTERP grades, but also lower levels of problematic smartphone usage. And were not the ones, obviously, the ones that were always online, but also not the ones that were completely offline. This group, the balance group, showed the best results at the end of the year. And in addition to that, balance is the key, but the online social context, as the other speakers were saying before, matters more than the time spent. It's really the social experience. When we think about adolescence, then there is also something that is extremely fascinating. One of my favorite studies show that if you tell to a teenager, a child, and an adult, someone is looking at you, it's a very simple experiment. There is no judgment. There is no positive or negative feedback. Just someone is looking at you. The teen brain will react completely differently than children and adults. The ventromedial prefrontal cortex and all the areas that are related to the social and emotional processing of the information, they will be very active in adolescent respect to other ages. And that is also correlated with higher levels of self-embarrassment. Because at that age, we're just biologically tuned to any kind of social information, more than in other ages. So that can have definitely a larger effect in the end on our well-being. And the importance of the social context is obviously in any possible way. I'm talking about the spectrum of interactions, from social comparison to feeling part of a community, so from the bad side to the good side. And we have seen that, for example, in a review of 78 studies, we have seen the role of social comparison. And social comparison can be 3 times worse for our well-being than what we call problematic social media usage, which is basically this kind of unhealthy attachment and problematic use of the medium because we are emotionally attached to that. And that is related to another problem. When teens go online, they go online with 2 different aims. From one side, we want to show, everyone would like to show the best version of themselves, sometimes even too idealized. But from the other side, we also want to connect with each other, right? But in doing so, we also see the best version of the other people, and then we end up with social comparison and what we call upward social comparison. So we end up feeling sad and lonely and left out sometimes. And the importance of the social context is not only from literature reviews, but also from a lot of data. At some point, I was able to collect more than 9,000 observations. And I was thinking, that's it. There should be something significant here. But actually, again, if we just look at the time, and here you see happiness and the minutes spent texting, the correlation between the two is flat. There's nothing there if you just look at the type of activities and the screen time. It's only when you start asking to the teens, did you feel part of a group or did you feel left out, that you see some differences. So again, the role of the social context. And finally, our need to be socially tuned with each other is a biological need. And since we are born, we start to bond with each other thanks to a hormone that is called the cuddle hormone, oxytocin. I've been recently working on this hormone. And you see a mother who is breastfeeding. In that case, there is a release of oxytocin that creates the bond between the mother and the baby. But what happens when the technology gets in the way What happens then? Well, you need to know that we experience the release of this hormone when we are in presence, when we can see each other, when we can hear the voice of someone that we love, when we hug, we cuddle, when we put a hand just to say, I'm here to support you. So we need the presence because the release of oxytocin, which is related to other systems like the stress and the addiction system, so if it is regulated, also other system will be, oxytocin cannot happen via text. It's not enough, also if you try to be supportive, but that cannot happen via text. We need something more. We need at least the presence of the voice. And also, as you can see here, everything starts again with parents, with modeling, with the parental behavior online, because teens, they just learn like that. And if there is a rule, that rule should apply to everyone. And again, yes, doesn't happen via text. So we need to balance tech and non-tech behavior. I will leave you with some tips from my studies and also from the work with the Digital Wellness Lab. So if we use technologies well, we can support our core psychological needs that are, for example, the need to relate with each other, so use the digital space as an extended space for our offline interactions, and also to increase our sense of belonging, encouragement, and connection, but also to create more autonomy and express ourselves and our skills and be creative and show our competencies in a way that is inspiring also other people. From the other side, of course, it's good to keep in mind that a pervasive use of the smartphone, especially during meals, when studying, or when upon awaking, is a bad thing for our health. And also relying on phones and chatbots to cope with negative emotions, so like as a coping strategy, especially when it becomes unflexible. And social comparison. Again, to me, social comparison is really the plug of social media more than the problematic usage of the platforms, because it can trigger sadness and bad outcomes with a larger effect. And sleep disruptions. Not only we know that you shouldn't use the smartphone before going to sleep, but also if you wake up during the night or as the first thing during the morning, it's better to avoid that. So instead of finding killer apps, we should find our killer bees, which is be mindful about how do you use the screen, and ask yourself, why are you using the phone right now, and what are you feeling, and try to be intent in a way to understand when it's a good thing that is adding something to your day, or it's just a habit that is taking time away from other activities. Being balanced between online and offline behavior, like a healthy meal, because in the end we can experience flourishing when we are in harmony. Be present, be socially present in the moment with each other in order to embrace all the activities that can give you that release of oxytocin that you really need to feel good. And then also be bored. We should learn again on how to be bored. It can be sometimes, it can be uncomfortable, but actually that is really what we need in order to self-regulate ourselves, but also in order to be creative. And when we are bored, we also self-direct our attention to what matters to us. And we are able to create meaningful memories that in the end are the most important part of our life. So I want to leave you with these resources. Here, there is the QR code to the book of Dr. Rich, The Mediatrician's Guide. It's a great book for teachers, educators, parents, and caregivers. And if you want to read something in Italian and shorter and a bit more fun, I also collaborated with the IPSA Foundation for Scientific Research with this little book for children, and half of it is a comic because it has been elaborated with students. So I want to thank you here, and go to the next presentation.